Once again, we appreciate you for honoring our invitation. My name is Wanjiro Kamau. I'm the head of Regulatory and Compliance Affairs. I'm a medical biochemist. And I'm happy to look at the list of the people that we were able to have a conversation with in Eastleigh. I noticed we have pharmacists, we have MOs, we have COs, and we have senior nurses. That means we have the whole group of healthcare providers. Why am I saying that is so important? When this lady gets to menopause, she's having difficulties at work because of the hot flashes, she's having difficulties sleeping, or when she has challenges with her sexual health, she's likely to talk to the nurse, she's likely to talk to the pharmacist before she thinks of going to the gynecologist. Is that true? Because the person who is taking her vitals happens to be so friendly to this person. When this man has turned 45 years old, 42 years old, he is getting to the next level in his career and he's having challenges with his sexual health. Or when he has been diagnosed with diabetes, and diabetes comes with its other complications, yeah? He will go to the physician, to the diabetologist to manage the diabetes. But most likely when he has challenges with his sexual health, he will come to the person offering the primary health care, equally. So it is good that we are all here, and that is a conversation that we are here to discuss, the biochemistry of endocrinology and how our products, which are pharmacognosy in nature, can fit into what you are taught in school. So we've had conversations with doctors all along, and some admit that the endocrinology that is taught in biochemistry and physiology when you are in school gets to be one of the few units that they get to use after graduating from medical school. I don't know what your experience is, but I asked so many doctors, how was your interaction with biochemistry in school? And you know what they tell me? Biochemistry wachana nayo. Lakini one unit I remember is endocrinology kwa hiyo. How is your experience? How many can say that they loved biochemistry? You know, I'm seeing doctors laughing. How was your experience? Which was good, yeah? Yeah, so this is what we want to discuss, and that's what I wanted to take you through. And first we are asking ourselves, what happens when this man is aging? What happens when you turn 30 years of old age, which is what they say that we start declining? There are so many changes that happens in the body. In terms of the productive hormones, the key ones to notice are estrogen and testosterone. But we also know that there are many other changes that do happen. For the hormones that do regulate blood pressure, you will agree that the sensitivity of the receptors go down, such that now when you're getting to climax 60, 65, many of the elderly are diagnosed with high blood pressure. Sindio? We also know that the sensitivity of the body to insulin starts declining from the age of 30. And it's possible to have people with challenges of managing their sugar levels, even if they are not obese, from the time they are 55 to 60. So this is the conversation that we want to have today. When this lady comes to your clinic, she's 44 years, she's 45 years, she started having perimenopause. Are you going to offer her any solution, or are you going to leave her? I was having a conversation with my friend there, and she was telling me that in the community in Eastleigh and Garissa, so many women don't talk about the challenges of perimenopause and menopause. You're having many of them who have lost libido, and remember she's married, yeah? Even if she's had her 7 or 5 kids, she is married, and there are expectations. What happens to that family? In that same sense, she's also having painful sex, because we know estrogen is very, very critical when it comes to arousal for a woman. And it is arousal that allows this woman to lubricate. It means because she has to keep her family intact, because she has conjugal obligations in that home, her quality of life is affected. And it is affected because every time the man comes home, she feels pain. And what is happening is just because of menopause. This lady is also likely to have infertility from that age. I was talking with her and which is a truth in our communities, yeah? Most of the ladies in the Somali culture will have finished the business of giving birth by 40. But remember, we now have globalization, we now have modernization, yeah? We have women who are investing a lot of their time in education. So in their early 20s, they are in school. By the time they are coming to early 30s or mid 30s, is when they are thinking of starting their families. Again, we are not only practicing in this setup. I see there is one of our doctors who is practicing also at KNH. And you find in these other setups, it is in mid 30s that the woman is now starting to have children. And at that level, they say by the time you're getting to 40, the number of your eggs is dropping. When you look at that oogenesis cycle, by the time she's in her mid 30s, even the viability of the oocytes has gone quite low. And also another sign of menopause is in the change in the mood, the anxiety, and the depression. And this is something that I was discussing with a gynecologist the other day, and he was telling us that for so long, he was not offering any solution for menopause, yeah? Because he used to believe that it is a natural occurrence. But it is when they discovered that from the age of 43, 44, 45, when the lady is getting to perimenopause, to the time that she actually gets the menopause, her mental health is not stable. She's likely to get anxiety. If it is not well managed, it's likely to lead to a depression. We are in a society where mental health wellness is something that our doctors are taking seriously. Because they say out of 10 patients who come to your clinic, 5 is because of stress-related conditions. Because they got stressed, the stress was not managed, they got a mild or a severe depression, their body immune went low. We all know what happens when cortisol levels are high, from their impact on digestion to the impact of the immune system, and even the ability of the body to absorb some other drugs. So imagine this lady, she's getting to menopause, and now she's at the office. She's so hostile to everyone who is around. Not because she's a violent person, not because she's a narcissist, not because she wants to be hostile to her employees or her colleagues, but it is the changes that are taking place in her body. And then one that we all need to address is the lack of energy and constant fatigue. And what happens when they don't have energy and they have fatigue? Most of them will take stimulants. They look for some coffee. They look for something that is likely to be addictive at the end of the day. In the setup in Eastleigh, we don't have a lot of people using alcohol, but out there we have people who depend on stimulants when they feel they don't have energy to move on. And then there is the weight gain. And we all know what will happen now when she starts accumulating weight, because the levels of estrogen are going low. We know estrogen helps in boosting the metabolism of the body. And when the levels go down, weight gain. And within 3, 4, 5 years, what else do we have? We have metabolic syndrome, yeah? She has issues with high blood pressure, she has issues with insulin and issues with cholesterol. But it didn't start because she was careless. It's the changes in her hormonal system that are taking place. So that when the body metabolism goes low, because the levels of estrogen are going low, what happens? Weight accumulation, and then if it is not well managed, leads to metabolic syndrome. And this is what my colleague was saying, that we have a solution for this woman. That it is not always that we should keep quiet. It is not always that we should tell this lady that menopause is natural. You can imagine when she's sweating in the office and it is hot as it is now, and there is no AC in that office. Is that good for her quality of life? When she's so anxious, when she's so depressed, and not because she has issues in her personal or career life, just because she is in perimenopause or menopause. This is definitely not good for her, and this is what we are saying, that as Toshana Investment Africa, we have a solution. Refine Me, as my colleague said, has got the 3 types of Maca. And I know this might be a new knowledge for you, because we discovered that it is only one institution in Kenya that is teaching doctors pharmacognosy. So we have pharmacists going through pharmacology, we have doctors going through pharmacology, and then their first and second years they're studying the biomedical sciences. But then in their 3rd year, their 4th year, when they are doing the clinical practice, they have the pathology and they are taught the pharmacology. But it's only one university in Kenya which is teaching pharmacognosy. And you ask yourself, why this happened? It is normal because our medicine curriculum, MDCHB, has a Western orientation. It is not so much oriented to the East, it is so much oriented to the West. You ask many doctors if all those textbooks, there was any that was written by an African, and there's a discussion we were having with another doctor, and he told me it's only histology and embryology that he came across a textbook that was written by a Kenyan and an African. All our books that we use in Kenya are either from UK or from US. And why don't they teach pharmacognosy? Because pharmacognosy is the use of plants for medicinal value. And when you are to use plants to offer solutions in healthcare, you are limited, because you are not able to do a mass production in a family, in a factory. But with pharmacology, it is the industrial intervention in giving a solution. That means you can set up a big factory, you start processing PDE5 inhibitors, you start processing antihistamines, and you give solutions to the mass population. But with pharmacognosy, you have to grow a plant like maca, you harvest, you dry, and that takes time. That means there is a very small number that you're able to reach. However, this is going to change in the near future. As I told you, now we have one university that is teaching pharmacognosy. That means our doctors who are now graduating know the pharmacological interventions and they know the pharmacognosy solutions. So what does our Refine Me do to your lady who comes to your clinic? Number 1, it is able to increase her libido and her wetness. I'm talking about that patient who comes and tells you that I never have desire for sex. That anytime my husband comes home, I don't have a desire, and I have allowed him to have other women. Will you offer her a solution, or will you keep quiet? The Refine Me gives a solution to this woman. The second thing is that it clears the symptoms of menopause. I have put clinical studies on your tables, studies that have been published in recognized journals, and they are showing the efficacy of maca. So our colleagues have requested we excuse them for 5 minutes, they're coming back. So the studies that I have put on your tables are showing the efficacy of maca in management of menopause symptoms. It's showing how maca is able to clear all the symptoms of menopause, and it is going details by details. Night flashes, how many patients recorded positive outcomes? Hot flashes, how many were able to record positive outcomes? When it comes to painful sex, how many were able to record positive outcomes? We can send the studies to you if you desire, and it has appeared that maca, and especially the black maca, is superior to the other alternatives that we have for the management of menopause. Again, our Refine Me will boost fertility, and it will reduce depression and stress. So the other question that we should ask ourselves is, why maca? There are so many other products that doctors have for helping ladies with menopause. There are soy isoflavones that you use to help patients with menopause. We do have doctors that use hormonal replacement therapy for helping ladies with the menopause. Why are we encouraging you to use maca? First of all, You remember that gynecologists 2 or 3 years back came with the message that the use of hormonal replacement therapy causes breast cancer as a secondary complication. Is that true? And they are like, we should stop giving our ladies estrogen when they are in menopause because it is causing breast cancer. The next alternative they had was soy isoflavones, and we have so many soy isoflavones in the market. But then again, another message was sent out. Wait a minute. Soy isoflavones target the same receptors as the estrogen or the hormonal replacement therapies. And they also tend to have the same effect, just like HRTs. We have a study here, it is in this table, that is showing why soy isoflavones should never be used for clearing the symptoms of menopause. And then doctors were left without solutions. But patients are asking, they have questions and they need answers. It is on those bases that we are saying Maca is good because it boosts the mood. Maca has got a very good safety report. There is a clinical study on your tables that is showing the safety profile of Maca. And this study was done on more than 1,000 patients, and then they looked at the complications at the end of it. And you notice that the safety profile is quite high, which gives you the assurance that when you give your patients Maca, they will not have negative outcomes, but you will have offered a solution to them at the end of the day. And then, secondly, other benefits of Maca, as we said, it boosts fertility. There is a study at the last table that shows the positive outcomes of Maca in boosting the fertility of male and the female. And besides that, it boosts the mood and it gives energy. You remember in the other slide when we were discussing the signs and the symptoms of perimenopause and menopause, one was fatigue, anxiety, and depression. Maca, there is a systemic review study in the second table that is showing that it has the ability to boost the mood and it has the ability to give energy that is sustained throughout the day. Which means that this is a good solution for the woman who comes to your clinic, because besides clearing the symptoms of menopause, who doesn't want more energy in the course of the day? So we all need energy, sindio? So she's able to get other benefits, and that's why Maca is good not just for the woman with menopause, not just for the woman who is having hormonal imbalance, but it's generally good because when you take it consistently, it helps you to go through the chaos and the hassles and the bustles that we do experience on a day-to-day basis in the city. We have some contraindications. We have to let you know for the doctors and the pharmacists who will be handling your patients. It's good to know that Maca, or Refine Me as we say, should not be used for your patients who are going through chemo and they have been given tamoxifen by the oncologist. Do not give them Maca. Also for your patients who have thyroid disorders, you are not supposed to give them Refine Me because of TSH and TH, the hormones that are released by the thyroid. And then if your patient is on warfarin, if your patient is on any anticoagulant, you are not encouraged to give them Maca because of vitamin K. There is a study in the, I think it's in the second table, that is showing the interactions of vitamin K and warfarin. And then we do not do clinical studies on pregnant women. We do not do clinical studies on women who are breastfeeding. So there is no safety data to show the efficacy and the safety of Maca on pregnant and women who are breastfeeding. So these are the clinical studies that I was using because in Kenya, I like our guidelines. We do evidence-based medicine. I know I'm talking to doctors who are used to using pharmacology solutions, but they are not used to using pharmacognosy solutions in treating the patient. So it's up to us to show you the clinical studies that have been done. These are the same studies that we have presented to the PPB to show that Maca is effective and is also safe for the people in the Kenyan population. So we have 4 types of studies. You know it takes time to go through studies. If you'd like us to send to you via email so that you can read them in details at your own time, we will be glad to do so. So we have systemic, we have reviews, we have double-blind studies, we have single-blind studies, and we have random controlled trials. Those are the 4 studies that we have to show the efficacy of Maca in boosting fertility, in managing anxiety, depression, and giving energy, and in clearing the symptoms of menopause. If you're a doctor who prefers to use the random controlled trials, just let me know, we have them. If you prefer to use a study that was a double-blind or a single-blind, just let us know, so that when you're prescribing Refine Me, when you're prescribing Maca for your patients, you do it with confidence, yeah? And you have authority, because you can't prescribe anything that you don't know so much about. And then you have the gentleman. The gentleman whose testosterone levels started going down at the age of 30. We have Miss TD. And Miss TD has organic Maca, yeah, the yellow Maca. It has got the red Maca, and it has got the black Maca, and it also has black pepper. Allow me to say at this point that we have so many Maca products in the market. In fact, when we were registering with the PPB, we thought we are the first ones, because the only ones that we had seen in the market had not been registered in the PPB, and we discovered there are many out there. When we've discussed this with the gynecologists, the physicians, and especially the diabetologists and the urologists, we discovered they know Maca. Maca has been in the Kenyan market for some time. But what is good with the Maca products that we're telling you about is that we have the 3 types of Maca. What you find common in the Kenyan market is the yellow Maca. Our product has got the 3, the red, the yellow, and the black. And Miss TD is a solution that we are giving for the man who has erectile dysfunction or who has infertility, and the doctor is quite sure that this has been caused by low testosterone levels. What are the indications? What signs are your patients going to show after 30 years when they are losing their testosterone by 10% in every decade? They will have ED. Your patients will have challenges having children. They are going to have reduced energy and chronic fatigue, and this is so serious because it is at this age that this man is quite busy at his place of work. They are going to have reduced body mass. They are going to have reduced bone density. This man is also going to have decreased motivation and self-drive. In fact, they normally say that men with low self-esteem, most of the time when the psychologists do the study, they get to discover that they've got low testosterone. And then they will also be subjected to anxiety and depression. I was talking to a certain urologist, and he was telling me this has been confirmed in men over 45 years of age, because this is when even most of them get divorced or have divorce in their families, not because of anything else. Just like the lady who was in perimenopause and menopause, this man is also likely to have mental health challenges when the testosterone levels are low, and then it also predisposes the man to type 2 diabetes. Now, besides age-related testosterone issues, this one that was going down by 10% in every decade from the age of 30, we do have other causes of low testosterone in men. One is related to drugs that they are using. If this man is using a lot of opiates, especially for management of pain, they are likely to have low testosterone. A man who is using a lot of antihistamines or frequently is likely to have decreased levels of testosterone. A man who is using beta blockers to manage their high blood pressure A man who is using the statins to manage their cholesterol is also likely to have low testosterone, and this one is not because of age, this is because of the drugs they are using. So now imagine a man who is declining in age. His testosterone started going down from the age of 30. He is now 45, 50 years. The testosterone levels are going down because of age. Then he is using some medication to manage his other issues, and that medication is also causing a low testosterone. See, that's a double attack. What's going to be his quality of life? And then we have others who will have low testosterone because of other comorbidity. If he has diabetes, if he has a heart problem, he is also likely to have low testosterone. And because these things happen in aging, from 45, 50, it tells you there are so many reasons that the patient who comes to your clinic, to your pharmacy, will need a solution to manage their sexual health if they have problems, because they are getting attacks from all the sides. And what are you giving at the moment? What are the first line solutions that our doctors are using for ED? We have the PDE5 inhibitors, and these ones are the ones that are most commonly sold. And you discover that the mode of action for most of them is on the cardiovascular system. I think Viagra and the other solutions that have sildenafil are the ones that are mostly sold in the pharmacies. They are so much known that even the patients nowadays are not going to doctors for prescriptions. They are prescribing it themselves. And what is happening? There are people who are using sildenafil, and they should not be using it because they have heart issues. I've been talking with diabetologists, and they tell us, when I ask them how they are managing the diabetes-induced erectile dysfunction, and they tell you the challenges that they are having is because most of patients with diet have an underlying heart condition, whether it is being diagnosed or not diagnosed, yeah? And they don't feel comfortable prescribing sildenafil because of the complications that are likely to be felt after, because the mode of action is in the cardiovascular system. And what do you do to help the patient who has diabetes? Welcome. I was talking with my friend, and she was telling me the prevalence and the incidence of diabetes in Kenya has risen so high that it is almost just like coughing, yeah? You know, the same way 1 in 10 people will have had a cough in their lives. She was telling me that the incidence and the prevalence is so high that in every family, like if you put 5 people here and you ask them, do you have a type 2 diabetes at your home? Yes, I know my uncle, I know my aunt who has this. And what do the studies tell us? That 50% of individuals with type 2 diabetes will have ED if they are men, and they will have sexual problems if they are women. How do we help these people? Because they still have families. According to Maslow's hierarchy of needs, sex is a basic need for every human being. They've been diagnosed with diabetes, and you know, in 50% of them, they'll get ED. And again, what do? Why do we have this conversation here? We say they go to the diabetologist for management of their sugars, yeah? But then when they have a cough, they'll come and you give them medicine, and then wanakwambia daktari tunaweza ongea kidogo. When a patient tells you daktari tunaweza ongea kidogo, unajua hiyo mnaongea kidogo, hiyo ndio shida zaidi, si ndio? Or how do you practice? Ni kweli? Because doctors are taught to read what is in history taking. You understand what is spoken and what is not spoken, yeah? That's why you ask a lot of questions, even including religion, which has got nothing to do with medicine. But when you're taking your history, you want to understand the patient in totality. How are we going to help them? If diabetes is so common, and we know 50% of them will have ED if they are men, And you know, if they are women, first will have issues with the arousal, secondly, they are going to have painful penetration and they are going to feel a lot of pain. This is why we have Blacksteel. And we are saying Blacksteel is different from Mistidi. Remember we looked at Mistidi. Mistidi is the one in green, yeah? If you can hold it. Yes. We said this one has got Maca. So if you are very sure that the reason your patient has ED, the reason your patient is having infertility issues is because of low testosterone, you will give Mistidi. How about if the ED is idiopathic? How about if the infertility is idiopathic? How about if you cannot tell if they have ED because they are stressed? You know, stress causes ED. When you cannot tell if it is because of blood supply to the penis, if you cannot tell if it is low testosterone, or if you cannot tell if they have ED because of comorbidity, we will encourage you to give Blacksteel. And the reason you will give Blacksteel is because of the ingredients in Blacksteel. Blacksteel have 6 key ingredients which, when they work together, it is a combination solution for your patient. First, it has Maca. You remember we said Maca has got benefits for patients with infertility, and it has got benefits for patients with ED. Then it has Tong Kat Ali. I don't know if you're able to read that. Tong Kat Ali is another pharmacognosy solution. It's a plant that grows in Malaysia. And the people in Malaysia use Tong Kat Ali for various reasons, but the key among them is usually to promote sexual health, to lower blood sugars, and also to manage the mood, anxiety, and depression. The clinical studies that have been published in respectable journals have given us studies to show the impact of Tong Kat Ali on fertility, especially male fertility, and in management of ED. We have a study that is in the second table that compares Tong Kat Ali on one end and sildenafil on the other end. And it is looking at how are the patients that were being managed on sildenafil and how are the patients that were being managed on Tong Kat Ali. And when they finished the study, they came to the conclusion that the efficacy levels of the two products is the same. That Tong Kat Ali alone in managing ED is as effective as sildenafil. But remember, there's something that we say that sildenafil, the mode of action is on the cardiovascular system. And most of the people who are using sildenafil have other underlying conditions. That is why when you get to our social media, we hear a man who died in this lodging, a man who died in this with us Ampango Wakando somewhere. Why? Because they used sildenafil when they had metabolic syndrome. So another study was done to show the efficacy of Tong Kat Ali in managing ED in patients with metabolic syndrome. That study, I think it's in the last table, and it was discovered that the safety report was quite good. And it is on this basis that we are encouraging that when you need to manage your patient with ED, use Blacksteel, especially if you cannot tell how it came about. If the patient is stressed out, that is why they are having challenges with their sexual health. Ginseng, I'm sure you know, is very good for management of stress. You know, ginseng is very good for management of anxiety and boosting energy. In fact, we came to discover, as we were doing our research, ginseng is the one pharmacognosy solution that the Kenyan doctors know more about. And it has been shown that it reduces stress, and this is why we have it in this product. So if your patient has ED, if they are having challenges with their sexual health because of stress, you can be sure of ginseng. How about if this patient is having challenges because of poor supply of blood to the penis? We have L-arginine, an amino acid that is known to increase or to enhance vascular supply in the body. We have calcium, and we all know the role of calcium in supply or in the contraction of the smooth muscles, and also in the vascular system in the body. And again, if the infertility is caused by low testosterone, we have zinc in this product. And you know, zinc is known to boost testosterone, it's good for male fertility, and is source of good for controlling of ED. In addition to ginseng, calcium, zinc, Tong Kat Ali, and the others, this product also has got what we call the proprietary blend. It has pumpkin seeds, it has got nettle extract, it has got oyster shells, it has got cayenne pepper, and all these work together to help the man with ED, the man with infertility, the man with low energy, and the man who needs to manage his sexual health. So this one is showing us the solutions that are used when doctors do not want to use sildenafil. Ginseng is so common, maca is so common, Tong Kat Ali, calcium, zinc, and arginine is the most common in the Kenyan market. And then we have also mentioned the pumpkin seeds, the nettle extracts, and also the cayenne pepper. And so now we ask ourselves this question: should we offer solutions? Because doctors are different. Even when you talk to pharmacists, there is a patient who will present with a condition, and they're like, that is normal. You don't need to treat that. Should you help the man with sexual health when it comes to you? I believe you should help this man, because number one, if you do not help them, they are going to buy products that have not gone through the PPB. That means they are not certified. That means their contraindications is not known, which also means their side effects nobody knows, and they are going to have negative outcomes. The other reason why I strongly believe that you need to help this woman who is going through menopause, or the patient with anxiety, depression, or with low energy, I believe you need to help them because as a society we should protect the family. Sindio? As Kenyans, we are known, we are strong for protecting the unit of the family, which is a basic unit in the society. We've even had our politicians defending the family unit at all costs. Our religious leaders, be it pastors or be it in the mosque, the imams, they will always be having discussions that are around protecting the integrity of the family. So if you give them solutions that are there to manage their sexual health, if you give them solutions that are there to boost their mood, to boost their energy, and to clear anxiety, symptoms of anxiety and depression, we are all working together as a team, as healthcare providers, to protect the family unit and to treat the individual. And remember, as WHO says, sickness or health is not the absence of disease. It is not the absence of pain. It is the person in totality, his emotional health, his mental health, his social health. That is what all contributes to health. That means if the man is having low self-esteem because he has ED, that man is not healthy, and as a doctor you need to give them a solution. And this is what we have. This is what we have discussed. We have Blacksteel. If the man has ED, either because of diabetes, either because of comorbidities or other drugs he's taking, or because of his lifestyle, if he's drinking too much, smoking too much, using marijuana too much, we have Blacksteel. If you can't tell the reason why this man has ED, we have Blacksteel for that man. For the woman who is going through menopause, for the woman who needs to boost her energy, she needs to clear her anxiety, her depression, she needs to balance her hormones. And the gynecologist who told me is going to use Refine Me for the ladies with amenorrhea to see if it is going to correct, because in his own research he came to discover that Maca is good for amenorrhea. It's also very good for ladies who just get it one day, which means there is a problem somewhere. And if you're very sure that the man is having ED or infertility because of low testosterone, we have this tip that you're there to give them. So at this point, I will invite my colleague to sum it up. She is going to close it up for us and take us to the next session.
Well, guys, school part is over, okay? The science and the school part is over. And so, let me just end this with why we have our products and what we do. And these are our key attributes, okay? The one thing that we know in life is what? Change. Change is always constant. The other thing that we know is that with medications, our solutions that we offer people, all of that is changing all the time. How does that happen? With new products, better products, higher quality products. That's why our product is so good. So some of our key attributes, as you can see, the country of origin has superior manufacturing procedures. All of our products are FDA approved. FDA approved is it's the United States highest regulatory board for all things food and drug. It's the Food and Drug Administration. The procedure to be able to have your products FDA approved is very rigorous, and it requires a lot of patience and a lot of science backing up your products, as well as they have been created in GMP certified facilities. Lastly, our products are also certified by the Pharmacy and Poisons Board. As you guys know, it is not an easy feat to be able to have your products also authorized by the Pharmacy and Poisons Board. Additionally, because we do take care to ensure all of our products are made with quality, we did also consult with the U.S. Embassy, with their trade department, to ensure that the manufacturers of our products are reputable, that they actually make what they're saying, and all of their products coming out are also regulated. Additionally, as you guys can see in our products are also packaged superiorly, okay? There are 2 seals to our products. There is the outer plastic seal, and then once you've opened it and removed the outer plastic seal, there is another inner seal that keeps our products well. Additionally, we've got a very long shelf life, all right? This is one of the big issues that we have. Our products have a very good shelf life in it because they are already produced at a higher quality. These are very easy to take, all right? Our products these are 2 caplets. I will show you guys exactly what they look like. The Refine Me and Maca are in capsules, and the Blacksteel are in tablet forms. And additionally, because these products are so well made and because the quality is so well made, if there are any side effects, usually those side effects include inability to sleep and heartburn. But the way in which we go around it, our recommendation for our products are, you take it initially 1 month supply. So each bottle that you're seeing on the table, this is a 1 month supply. Each 1 month supply contains 60 pills. You take 2 pills in the morning with your food, and that's it. That's it. You will start to notice your clients, the ones who are having real problems, we suggest you finish it and you use as directed, taking 2 pills in the morning while you're having your foods. And the beauty is because these are all natural products. If now, let's say your client, your patient has noticed a difference, they're feeling better, they are noticing an alleviation of their symptoms, now this person can self-regulate. Because these are natural, if they choose to stop taking the products, it's just going to go out of their systems very naturally. They're not going to feel a weirdness inside of their body. They're not going to have any other side issues. It's just going to go right out of their bodies. Okay. And so, this is what they look like. As you can also see, they're also very visually appealing. It doesn't look like super medicinal, but it also doesn't look like one of these overly sexualized products. We wanted to make sure we were keeping in line that we wanted something of quality and value for the people. And so this will be the end of our presentation. I really enjoy it. I appreciate that you guys have come and taken your time out today. I understand it is a Saturday, and we've all been working hard this week, so I do appreciate that you guys have taken the time to sit with us just for a little bit of time, just to learn about these new products that we have available, that you guys can provide solutions for your patients, and in turn, happy patients, right? Better things for you guys. Okay, so let us end our presentation with any questions that you guys might be having. What I'm going to do is I will ask for you guys to take a look at this, and then let me also show you guys what the pills. Winnie, if you don't mind, in our little thing, maybe you could just show them some of the little packages so they can see what our products look like. Okay, so any questions, any thoughts? Madam Dior over there, do you have any questions for us? Your shirt says Dior. Thank you. Yeah, just show us.
My question is, are there any long-term side effects of using the drug, especially when starting the drug for patients at the age of 30?
No, from the science, it's seeming as though that there aren't any long-term issues that have come up. As I had stated to you before, generally what we're seeing is people are just having maybe some issues with the insomnia or having heartburn. But also, as my colleague had said, there are certain, for instance, when we had gone over there with the contraindications, there are some people who should not, right? So for instance, on our team, everybody has actually tried our product. I myself have not tried our product because I have a thyroid issue. So it's kind of unfortunate because all of these guys have like felt great about it, you know, and then I have not really had the benefits of being able to try it. So in terms of long term, from the science and from the research, it's not looking as though there are any issues. So I'm giving you guys these just so you guys can just really see what we're talking about, because the other thing is, right, when these things are sealed, you're not able to